All right, well, good afternoon, everyone. Thanks so much for joining us today. Really appreciate you attending what is now our third um, webinar, and actually the first one we did was in person in partnership with the Community Foundation. We're really excited to talk, quite frankly, about a non-housing topic in this town. So to try to bring to light that affordability reaches a lot of different areas, while housing is certainly the most important. Childcare is a major expense for the 25 to 44-year-old group. My name is Andrew Wolk, and I am one of many who is driving Steamboat for All, and really happy to have Jennifer here helping with the presentation as the campaign, or I should say, Steamboat for All coordinator. I'm going to give a brief introduction for those who are new to Steamboat for All. We're still getting our legs sturdy here as we try to do good work for the community. So we want to make sure that people have a brief introduction to our work. And then I'll introduce the topic for today and pass it over to Megan, our speaker. Um, so um, Steamboat for All's mission is to preserve the economic diversity and sustain a thriving workforce in Steamboat, ensuring that the people who are making our community vibrant, local workers like teachers, healthcare workers, first responders, can afford to live, work, and thrive here. We're particularly focused on supporting the individuals and their families, 25 to 44 years old, who work and aspire to work here, and have felt that we've sort of identified that that group of people sort of hits a roadblock and can't find a place to live, or look at where they're living and can't really make expenses meet to and find and build a future here. We have two focus areas of how we work, educate and accelerate, that I will just tell you a little bit about. On the educate side, we really seek to be in a news overwhelming place, a trusted voice for the community on affordability issues. And today's topic is a good example of that. Areas that we intend to do are areas like convening for like today, publishing, where we've hoped to put our first newsletter out within the next few weeks, reporting on various things that are going on in the community, and storytelling. Our second area is what we call accelerate, and that's where we're looking to identify opportunities and provide support to accelerate solutions on affordability issues. So we'll look and see if we identify opportunities, support moving them forward, and optimally, where we think we can add the most value is to provide funding for those opportunities. Um, some of the activities we've done to date, to give you some examples of both, are we've provided the City of Steamboat funding to develop what is in the process right now, an affordable housing dashboard. And we're hopeful that that will come out in Q1 of 2026. We've already hosted two webinars, the first with the Community Foundation on city housing policy. And we've also did one on the first phase completion of the Affordable Housing Dashboard. And both of those are on our website for you to watch if you haven't seen them, as well as today we're recording this one. So everything we do, our main intention is to record it and put it out there so people can go to it anytime they want. Also, as another example, we've provided funding to launch a program called the Savings Collaborative that is being led by the Chamber of Commerce, to support the advancement of financial literacy, to help with affordability, things like savings and debt reduction. We just got our first report back on some of the success since the Chamber has been executing that program, and the numbers are really quite strong, and we'll be able to send some of that data out in our first newsletter. And then lastly, we have hired a local Denver firm called Routt Policy, who is working on a policy paper to give us a better understanding of the policy options that we have in this town, focused specifically on housing and childcare. Our hope is that that will come out sometime in October or November. Now to our topic for today, the true cost of care. I am super excited. I reached out to Meg, I think it was 8 weeks or 9 weeks ago, to share what we were up to. And she told me about this research project that she was on, and I said that this would just be the ideal thing for us to help you launch and get out in the community. And so we're super excited to have Meg share with us the results of that. Families in Routt County face a 6-to-1 wait list for infant care. Tuition costs continue to rise, and there's a shortage of qualified teachers. And so this is affecting parents, businesses, and the strength of our community. So Meg is going to share in this webinar the findings from that new study that highlights the economic impact and the challenges and strategies for sustainable local funding. The way this will be done is I'm going to pass this off, and Meg is going to put up her slides. And she and I have talked about, I think we'll be able to have um, two different breaks before the end of the presentation to just take a pause and for people to ask either clarifying questions or questions you have for what she's presented up till that point. I will help facilitate though, to keep us on time to make sure that Meg can get through all this and we don't run out of time. So I'm going to stop sharing and let either Jennifer or Meg pull up her presentation. And I'm just super excited to have you here. Thanks.
Yeah, thank you so much. Thanks for sharing all the things that you've been up to. That was great to learn too. So my name is Meg. I am the director of First Impressions of Routt County. And before we get started, I just wanted to say how grateful I am for this space and for all of you being here, and the opportunity to share with you about early childhood and childcare and what this really looks like in our community. So before we dive into some of the data, I just thought I'd share a little bit about First Impressions for those of you that don't know, which it is great to see so many familiar names on here. So sorry if this is redundant, but First Impressions serves as the early childhood council for Routt County. So we are housed under the Routt County Department of Human Services, but we are pretty much grant funded. We are a program of the county, and through that, we are able to offer a lot of different programs that are really based in birth to 8 years old, but even more specifically, our touch points are really birth to 5. So those children before they're entering kindergarten. Some of the things that we do are tuition assistance programs to help families with the affordability of care. We also offer navigation for families who are searching for care, as well as some family parenting programs. We offer the fatherhood program and the nurturing parenting program. We do professional development for teachers, as well as things like this, systems building and working with community partners to advocate for families of young children in our community. And we really think that this matters because when childcare is available, families are able to work and thrive, children are ready for school, teachers are supported and they stay here, and this helps our economy and community get stronger. So, one of the things that's really important to note as we start talking about early childhood is that this really is a fragmented system. The funding and the systems within early childhood are all over the board. Um, Funding comes down from the federal government into all sorts of buckets that are a little confusing and hard to access for a lot of our childcare providers. And then on top of that, they have health code to deal with, as well as licensing barriers. And so there's just all these different things that are really standing in the way of having a successful system. And so with all of this, these providers who are trying to care for children are also trying to navigate this and they don't really know where to turn. And so we hope we help them with that. But what we're really seeing is that the burden of navigating this falls on providers and families. So First Impressions hopes to be able to come into this space to elevate this issue in our community and bring awareness for these families that we see are leaving, just as Andrew spoke to those 22 to 44-year-olds in our community. So early in the year, I want to say this was probably springtime, our council set out to really figure out what this costs. We know that there is a capacity issue and we know childcare is expensive, but what does this really cost? What does that look like? So we partnered with a group called Brodsky Research, and we had four main outcomes for this project. One would be determining the reality for families. What is this costing Routt County? As well as what would the return on investment look like and what are some tangible community solutions? So I will say the next couple of slides are really data heavy. So I'm going to get through them, but then as Andrew mentioned, we'll have a pause break. So if you do have questions, please make sure you share them because I love hearing feedback. So this first graph is the population of children 0 to 72 months. That's about 6 years old. So 0 to 6 years old here in Routt County. And this is important to know because we really want to know how many kids are there? Who are we really talking about when we're talking about childcare? Most kiddos go to kindergarten when they're 5. So for the purposes of today's presentation, I'll refer to them as birth to 5. But right now in 2025, we're seeing about 1,222 children in our community birth to 5. And I think this graph is really important to see it laid out this way because the blue bars are going to be Routt County. The golden line is Colorado as a whole. And so you can see we're really in a slump right now, which means that everything we're talking about today is going to get increasingly worse if we don't do something about it. And I think there's a couple of reasons for the slump. One of the most notable would be COVID. The children here in 2025 would be COVID babies or COVID children. So parents likely who were thinking about expanding their family during the global pandemic might have thought differently. And so we are seeing lower numbers right now. So this slide is just a snapshot of what is the capacity right now. So currently in Routt County, we have 16 licensed providers. And if all of those providers were fully staffed, we would have about 647 spots available. And I say when they're fully staffed because we know a lot of our childcare providers are not operating fully staffed. So this number is probably even lower. But for the purposes of a snapshot, we're going to go with 647, which means we have about a shortage of 269 spots. And we came to this number thinking about, all right, we know we have about 1,200 birth to 5-year-olds, but we know that not all of them probably need childcare. This is a really personable decision. Some families may have the ability to stay home. Some families may choose to, do friends, family, or neighbor care, or some might have a grandparent available. So there's lots of options. So we went with the number about 75% of the population needing care would be 916 children. So that's where we get to this shortage of around 269 spots. This is really significant for our birth to 2 childcare spots. When I was preparing this, we talked about the 6-to-1 ratio in the title, but we pulled some more recent data from childcare licensing, and that number is looking a lot closer to 1 to 10. And that's because since this report, we did the data collection for this report, we have continued to lose childcare facilities. Most notably would have been Young Tracks, which was the largest childcare facility in Routt County, and they did serve infants and toddlers, as well as losing some family childcare homes. And so we really think that there's 36 licensed spots in Routt County, and I would be shocked if even all of those are being utilized right now. So for our infants, this is really significant. Another thing to note when talking about capacity is we have these 647 spots, majority of which are preschoolers, so 3, 4, or 5-year-olds. And 57% of our providers are not offering care in the summer. So a lot of that's going to be our school district providers. All 3 of our school districts in Routt County have early childhood programs serving preschool age, but they close in the summer, as well as some of our childcare centers, private childcare centers, and family childcare homes. So 647 spots, and that's reduced by 60% in the summer. So we Definitely have a year-round shortage as well as an infant toddler shortage. And so these two graphs just kind of talk about where these spots are in the county. It's not surprising, majority of the child care centers are going to be here in Steamboat, but we do have childcare countywide. Looking at the percentage by age, Steamboat has about 6% of our spots are dedicated to infants. But as you can see, the majority, 78%, is going to be for mixed age preschool. And that's really across the board, even down to South Route, who 100% of their childcare spots are going to be mixed age preschool. And there's a couple reasons for that. The biggest would be that infant care is expensive, mostly because of ratios. So to have an infant center or an infant room inside a childcare center, you can really only have one adult for every 5 babies. If you have a preschool room, you can have one adult for up to 15 or 20 children. So you're able to bring in more revenue with more tuition than you would for an infant spot where you only have 5. So it's just a lot of the centers who are able to have infant care usually have preschool to help subsidize that, or they're employer based, like the Steamboat Resort or the hospital has grandkids childcare. They're able to offer this as a benefit to their employees, and that way they can justify the cost. So, just one more here before we take a pause. I wanted to talk a little bit about affordability. So, we know there's a capacity problem, but there's also an affordability problem. Childcare is the second highest household expense after housing. When we did this report, families were reporting 16 to 28% of their monthly income is spent on childcare. If we break that down based off of the median annual household income in Routt County, it's about 20% for one child in care or 40% if you have 2 children under 5. The average annual cost for a child to be in high quality care, we'll talk a little bit more about high quality care on the next slide, but high quality care is $21,000. So we're looking at just almost as expensive as college tuition. And I think that this is incredibly important to note because this is really impacting our middle income families, families who are working, families who are contributing and who want to work, but they don't really meet any of the thresholds to access subsidies or support. But they might not also have a high paying job that can justify 50% of your income going to childcare. So the reason I wanted to talk about high quality care just real quickly is because it doesn't really make sense to talk about low quality care. But people often ask me, why is childcare so expensive to provide? And why do you talk about high quality care? And it's pretty simple because high quality childcare really is a prevention strategy. We know the data shows that putting children in high quality care settings is going to have significant impact in later in life or down the road. This is shown by high school graduation rates, adult employment, or taxable income. And so Brodsky suggested that for every single dollar that's invested in early childhood, you get $7.30 return later in life. And that's because these are going to be classrooms that have lower teacher ratios. So although you could have 20 children in the class, a high quality center may only have 12 or 15. And just making sure that these teachers are well compensated and highly skilled. This is not an easy job to take care of children, and nor would we want people taking care of the youth that aren't qualified to do so. So before we pause, one quote from a Routt County parent. She shared with me, this is a dual income family, 2 children in care. My entire paycheck goes to childcare and healthcare for my family, which means that her spouse is responsible for literally every other expense that this family would have. So mortgage, groceries, gas, activities, anything that they might want to do outside of just going to childcare and having healthcare is all on one income. So I did want to take a time to just pause. I'm happy to click back to any of the graphs that you might have questions about, but I would love to know what questions you have or even just thoughts or comments about all of those things.
And people can just unmute yourself and then you can use the little marker for raising your hand but
I've got one in the Q&A. Does your data show capacity and options for children with disabilities?
It's a great question. So we did not differentiate for that. Currently in Routt County, children with disabilities, if they're under the age of 3, they are served through Horizons. And so there's a lot of different ways that can look. Horizons can provide the services in the family's home, or we have seen where Horizons can support the child care center in knowing how to handle the unique needs that that student has. For children who are 3 years to 5 years, they fall under the under the school districts. So Hayden, South Route, or Steamboat would be the only placement options available for those children to receive services.
I mean
We,
this
we've got a few raised hands real quick. Tracy?
Hi, thanks everyone. I was speaking with someone yesterday who works at a licensed preschool, and they said they have open spots. And I think that speaks, Megan, to your comment about lower numbers right now,
Mhm.
but that the real need is in infant, but you can't do infant without preschool or toddler because the numbers don't work. So can you just give your insights on that?
Yeah, that is such a good point, and thank you so much for bringing that up. I think a couple of things. I do think that we are just seeing lower numbers right now in general, but we have more preschool spots than anything else. As you can kind of see on this graph, especially, we have more preschool than we have children that can fill them because we don't have the infant toddler care available to retain families. Those first 2 years that families are struggling to find care, those are the make or break. And if they can't stay, we often see them leave before they even get to preschool. So, talking with a lot of the school districts about this issue, they're really interested because we want to make sure that we can continue to have enrollment in our public schools as well. And if we're leaving the young families before the children are even 3, that's going to have a ripple effect. So I think the biggest reason why we're seeing decrease in our preschool facilities is because we are losing these families before the kids even get there.
anyone else with any questions? I had one. What do people do in the summer? If I understood correctly, you're saying that there's no summer offering in general, or did I not understand that? And then so what
Yeah.
parent working households doing?
Oh, well, I think we know about one thing about families is that they are creative, resourceful, and whole, and they do a lot of different things. For me, I have the luxury of having an employer that understands and has allowed me some autonomy to work a little more remotely at home. I had a friend share with me that she saved up all of her vacation time so that she could be home in the summer, which that's not ideal because you're supposed to use vacation time to reset and recharge. And so I think I don't know a lot what families really do other than just survive those few months. It really impacts our preschool age children the most because, like we know, the birth to 2 year olds, those families are already struggling. So they're either figuring it out or leaving. But those families that are in these preschool programs for the summer, they really don't have an option. Um, the city programs start at 5 years old. A lot of the summer camps start at 5 years old. So for those summer months, 3 and 4 year olds really do not have options.
Hmm.
Yeah.
Well, why don't we have you continue on to the next
Sure.
section? Yeah.
Okay. So the next couple slides kind of speak to what is this costing and what is this costing Routt County specifically? So in a study that was done by Executives Partnering in Childcare in 2022, they estimated that because of the lack of childcare in Routt County, we are seeing a net loss of around $10 million annually. And they did say there is really no line item in a budget that represents this cost, but it's a hidden cost to our community because of our lack of care. And along the same lines, Brodsky estimated, based off of some of the unemployment rates that, which are low, but it's still significant. If we had a fully a childcare system that could really support all 916 children that need it, we would see an increase of about 400 workers. They're already here, they're just not working. But we'd see 400 workers could re-enter the workforce, and 92% of those would be mothers, which I think is important because we know that childcare really, and the lack of childcare really disproportionately affects women. And as you can see, 92% of the people who would enter the workforce are women. That's a pretty big statistic. And so one of the things that our council did as just an activity as we were thinking about some of the messaging we wanted to get out to the community was thinking about all of the things that we love that are brought to you by childcare. This is certainly not an exhaustive list, but these are just some of the things that our group thought, these are all the things that we know and that we love and that make Steamboat Steamboat. And these would not be possible if people were not going to work. I really love on here, somebody wrote Freshies cinnamon rolls. I mean, yeah, we wouldn't be able to have Freshies cinnamon rolls if somebody wasn't going to work to make those. And it's highly likely that a lot of the people who work in our restaurant industry need childcare. Thinking about things like the 4th of July parade, there's so much planning and prep that goes into that. The Routt County Fair, the Steamboat Marathon, I mean, even Run Rabbit Run, what a big event. And all of those require people to be at work. And how do we get to work? We have childcare. This is a quote from a Routt County business owner. She shared with me, my team, who provides laundry services for Steamboat restaurants and hotels, is comprised of over 50% parents. If they do not have care, we do not have napkins for restaurants or towels and sheets for hotels. I think that's pretty powerful to state too, because so much of our economy is based off of tourism. Well, if we can't provide the high level that our guests are looking for, or even just really low bar of sheets and towels, people probably aren't going to want to return. And so that's pretty powerful. And so we will take a pause after this slide because this is a big one. But this slide just really shows how much would it cost if we were going to have spots for 916 children in high quality care settings. This would cost $17.5 million annually in Routt County. And I know that's a big number, but some of the things to think about in terms of the cost drivers for why this number is so high, the two main ones are personnel and facility costs. So it takes a lot of people to provide childcare, especially if we're doing it for birth to 2. And additionally, real estate is expensive in Routt County. So whether the childcare center is owned and they're paying a mortgage or if they're renting, those are really, really staggering costs that drive the cost of care pretty high. Right now, we have some current subsidies that are supporting this, about $2.1 million. This is in tuition assistance. This comes from First Impressions through the HRC and through the Amp Valley Community Foundation, as well as United Way has tuition assistance programs. And then some 2 big state programs are the CCAP, or Child Care Assistance Program, as well as Universal Preschool. So those are bringing some money here to Routt County to provide care. And then the middle bar represents what families would pay in tuition. So if families were actually paying the 7%, not the 20 or 28% of their income, but 7% of their income, we estimated that would be around $7 million toward the cost of providing care, which still leaves us with an $8.3 million gap. And so I'm pretty sure I have a pause. So yes, So I wanted to stop here and answer any questions that you might have on the gap.
Well, I'll start. So when you describe that gap,
Mhm.
um, that would both provide the slots needed and at a quality level and price level that would be more reasonable. All three?
So the 17.5 doesn't really take into consideration the cost that would be reasonable. It really just takes into what would it cost to provide the care for all 916 children. And so what families would pay at 7% of their income, which is reasonable, would be 7 million. If we bumped families up to 20% of what they're paying, which is what they're paying now, that 7 million would probably be, we'd probably only have $1 million gap. So, but I think when looking at what is needed to fund this, it's important to differentiate that we don't want families paying 20% of their income. And so we use the 7% because that's the federal guideline.
Gotcha.
Mhm.
Other people have clarifying questions or even comments at this point?
Just making it really make sense, I guess. Um, okay, well, if there aren't any, I'm happy to go into some of the solutions that we think. Um, so looking at this from an early childhood lens, I am a former early childhood teacher, so we're going to talk about building it up like it's a little block tower. I think there's really four main components to fixing this broken system. Those are local investments, capacity building, tuition subsidies, and quality initiatives.
Hey,
So
Megan, sorry to
oh,
interrupt real quick. Judy did just raise her hand real quick, so I thought
oh, sure.
in case it's about previous slides, we might give her the opportunity to ask a question. Go ahead, Judy.
Maybe Judy's on mute.
Maybe I don't see her on mute. Let's see.
Yeah, I was unmuted, I guess.
Okay.
I don't know. Can everybody see? I can't see everybody else who's on the call. I can just see the speaker. Is everybody on the, can you see everybody?
Yeah, we
Yep.
have about 13 or 14 participants.
Oh, I can't see anybody. Um, the question I had is, will a copy of these slides be available, like a copy of the deck, if we wanted to, to refer to them versus taking a lot of notes?
Yes, I'm happy to send out the slides.
Okay, thank you.
Yeah,
And
we'll definitely do a follow-up thank you email with the slides and check in, Meg, if there's anything in particular you want to share as well. There may be other things you want to add to that for sure.
Great.
absolutely.
And then we had a question from Tim. Go ahead, Tim. Let's unmute him.
I unmuted myself. So there. Am I good now? Can you hear me?
Yes, you're good.
Quick question for you, Megan. I'm back on the slide. One thing I hear a lot is that the need is for more childcare facilities. And I'm wondering if that's true or whether the need is as you framed it. It seems like the way you framed it, it's more about cost of personnel and I mean mainly it's providing funding for providers. But can you speak to that?
Yeah, that's a great point. So I think it's both. But yes, capacity, physical space is a huge need. Um, Even if we gave $17 million to the childcare centers we had, they wouldn't physically have enough space for all 916 children. So we do need physical space, whether that's a childcare center or that is a family childcare home, or that's utilizing childcare centers that are sitting empty over the summer months, looking at what we can already build upon that we know is licensable. So I think it's both, because there is always this conversation of like chicken and an egg, right? So we have this childcare facility now. Well, who's going to work there? So if you build it, the children will come, but we also need to be mindful of how we will fund the staff. Does that answer your
So
question?
yeah, I think it does. And then, but then my next question is, so what is the cost of the additional facilities needed, or how do you quantify the need for, how many spots need to be made available through just building new facilities? And what would that
Yeah.
additional cost likely be? And I'm assuming then that that's on top of this $17.5 million annual cost of running childcare centers.
Yes. So the 17.5 is an estimate, and it is based off of what providers are currently paying in rent and or mortgage. So the 17.5 does include, if we had the current number of childcare centers that we have and we multiplied it until we got to 916, it would take their current costs up to the level of 916 children. So it does factor in the annual cost of whether that's rent or mortgage based off of what providers in Routt County are reporting that they pay. It doesn't really consider new construction build.
So, so just to build off Tim's question, then is the assumption then that if we had the money to fill the slots and get more workers, we have the space for them to do the work and or live?
Yeah. So I think you could look at the 17.5 million as if there was space. So the space is there, it's built, it's licensed, it's happening, and they're staffed. It would cost operationally 17.5 million.
No, I get that. I think where Tim
Okay.
is, sorry to sort of add to your point, but I think because the city has their own facility project, is the assumption is that we actually don't need more facilities, that we could, if you filled the gap, there are
Yeah.
places for them to conduct their work and live, right? I think that's, if I
I think,
understand, that's sort of where you're going.
yeah, I think we do need facilities. I don't think we need any more preschool facilities. I think we need facilities that would be for 0 to 2
Okay.
because there's nowhere to put those children right now.
Yeah.
Yeah. So, and I think that kind of builds up here. So, I feel like when we think about the solutions for this, local investment really has to be in the bottom. And yeah, that can refer to dollars, to actual dollars, and looking at what levers can we pull to fund childcare. But it really means that we as a community need to recognize childcare as an essential community infrastructure. We have to say that this is worth putting our efforts and our dollars towards. And with that, to your point, Tim, I truly believe the second building block in this puzzle is capacity building, specifically for 0 to 2. I feel like it would be an absolute disservice to this community if we just went and built a bunch of preschools, because we know that there isn't a need there. But I'm going to rush through this one because I have a video that will explain this a little bit better. Some really creative solutions are coming from other communities in Colorado around family childcare homes. So, as a point of reference, pre-COVID, Routt County had around 30 family childcare homes. So, this would be individuals providing childcare in their home, often to birth to 2. So, those infant toddler spots were really in our in-home childcare facilities. With the rising costs of real estate, we are just not seeing these replaced, and we currently have 4 licensed family childcare homes countywide. That's for the whole county. And so this is a 4-minute video, and it's so important that I just really think this is important for us to watch, and then we can talk about it. But this is what they're doing to address this in Ouray.
Oh, we can't hear him.
Oh, no, you can't hear. Let me take my headphones off. Got to be able to hear. Okay, I hope this works. If not, I'm going to have to send it to you all after the fact.
Don't have enough affordable quality
Can you hear it now?
Yeah, we can hear it. Or we could. No, now it's not on, at least for me.
Yeah, I can't hear anything either, Megan.
Okay.
We could hear it a moment ago and then it went off. Sorry.
Oh, I paused the wrong thing. Okay. Well, what I can do is I can just share this out to you all. But in a nutshell, in Uray, they had an affordable housing and childcare crisis similar to us. And they chose to meet these needs together. They had a parcel of land where they built up about 20, they had space for 20 single family affordable homes, and they chose to create two of those as family childcare homes. And the way that they did this was almost like building on a sidecar to the house, so that the individuals who would later become the owner and operator could close off the childcare business portion of their house. You can kind of see it in this bottom photo, although this provider has the cribs in her what seems to be kitchen, but you can kind of see how on one side there's the childcare center. And this was so incredible because they were able to provide small business development classes and trainings to the individuals who wanted to operate these childcare centers. And they worked with a group called Mission Driven Finance to bring the property from a market rate down to an affordable rate that a childcare provider could afford based off of offering a reasonable rate for tuition for childcare. So they really thought about all the components to this. And I think this is so cool because we really need to get creative about thinking about housing and childcare. With this development, out of the 20 homes, two of them were family childcare homes and 18 were just affordable housing units. But all of the families who now live in those 18 homes have childcare. So those families will likely stay. If we continue to build affordable housing, but we don't address childcare, how will we continue to retain young families? To me, this project is beautiful because it really built affordable housing and childcare in tandem so that those individuals who moved into this neighborhood could stay. And both of the childcare providers have been really successful in their first year of operating. These two homes increased capacity by 24 spots for infants and toddlers. So it's pretty amazing. I'm sorry the video didn't work. I will send it out to you all. But thoughts or questions about that project?
Yeah, we've had not about that project, sorry, but I will ask this question and you can come back to it if you'd like. What's the current thought about the possibility that existing federal funding will be reduced?
Mm. That's hard to say, but I mean, I think it's probably trending like yes. I mean, I would plan that federal funding is going to not be a reliable source. Um, I know in terms of tuition assistance from federal funding, there are big changes that are happening to the CCAP program, the Child Care Assistance Program, in which the threshold for eligibility is going to be significantly lower. So it's going to really be for those most at-risk families. And those families will get a lot more of a subsidy, but we're going to see an increased gap in our middle income families. So although it's helping in one way, there's a unintended consequence that we're going to see more middle income families not able to access that funding stream. In terms of other known cuts, I just don't know. But it doesn't look great.
We have
So
Erin. Erin has raised her hand. Go ahead, Erin, if you.
Yes. Yep. Can you hear me?
Yep.
Great. Meg, thank you for explaining what that video was to show. I really look forward to watching it. I think that it's amazing idea to target several of the things that you mentioned today. One of the things that I was thinking about earlier was, well, why don't we shift the focus of some of our preschool providers to infant care or infant and toddler care? But as you then subsequently explained that it isn't that easy and the cost of infant and toddler care is so high. So, that you are putting childcare and housing together as critical shortage needs for our community and offering this solution. I think it's very powerful. So look forward to that video.
Coming your way.
If other people don't have any particular questions, if it's okay, Meg, I mean, I would be curious for people that are on the phone to either do one of the following two things just to get a little bit more engagement. Either why you decided to join today, to learn more about childcare, just to give us some context of what hat you're wearing in terms of understanding the issue and where you hope it might go, or any feedback you may have for Meg about the presentation. If I'm not mistaken, this is your first unveiling of it, right?
Mhm.
Of many to come, because I think you expect this to be a core part of First Impressions work, right? This is the first step of a larger strategy to try to really fix, a relatively challenging system right now. So for those who are willing to share either what hat were you wearing to join the call and be interested in the issue, and or any feedback you may have for Meg as she continues down this journey, which is wonderful to have her taking this kind of energy to it. Yeah, Steve, just jump right in.
Actually, this is Debbie. I just clicked on a link when I signed up and it had been
Oh,
sent to Steve. But this is Debbie Mochaleski. So one reason we're joining in is that and Steve is called Moz. I can't even call him Steve. He's been called Moz for 40 years. One reason we are interested in this issue is that we have kids in town who have encountered exactly the same problem. They, of course, have a lot more resources, including we grandparents, to help out. But we're more interested primarily in the supply side than in the of both facilities and teachers. And so the reason I joined is to get a better understanding of um, where the gap is. And if I can summarize, just to make sure that I have it, my understanding is correct. The gap right now is in finding qualified staff for existing spots, and then facilities for toddlers, infants and toddlers. Is that in a nutshell? Is that true?
Yes.
But
Mhm.
even with existing facilities, staffing is the most immediate issue because obviously facilities has a long lead time, but staffing is the biggest roadblock right now for infants and toddlers.
Facilities is the roadblock for infants and toddlers.
Oh,
There is not, we do not have infant and toddler providers. So a lot of our childcare centers are not operating at full capacity, but even if we put teachers in those spots, it wouldn't open up infant toddler spots.
so the current unfilled capacity is in older groups.
Mhm. I
Okay.
mean, it's kind of a mixed bag. I can see if I can try and target that a little bit better as to what age groups we're having staffing issues in. Um, but I don't think even if we got 5 teachers today, it would do hardly anything to support families with 0 to 5 or 0 to 2 care. It really, the 0 to 2 is really, it's both. It's facility and staff. And that's where I think some of these family child care homes could be an interesting model because it's solving a housing issue as well as a child care issue without having to build a child care facility.
Okay. Thanks for clarifying.
I'm really glad you asked the question the way it was, because I think what would be really helpful, um, Megan, we talked a little bit about this in terms of where Steamboat for All is trying to sort of support is, I understand that the study, did a really good macro job at what's the state of childcare right now
Mhm,
and what might be a way to fill a gap.
mhm,
I think a summary though of very specifically what is the true issues going on today in terms of limited slots, lack of teachers, lack of facility within that 0 to 2 in preschool range would be a really helpful addition to this, and one that I think we could send out also as part of your slides. Um,
mhm,
so it's sort of the micro, what's really going on today that we might be able to, in the short term, try to address while we're also trying to systemically deal with this issue at the same time.
mhm.
Would be, I think, really helpful.
Yeah, it's tough because we know what we have for license capacity. We have 36 spots. Um, and we could maybe staff could help take but okay, so sorry, let me refresh that. We have 36 spots. That's still only 1 in 10 infants currently. So what would it take? So looking at like how many staff do we currently have for those 36 spots? That might be an interesting number to try and figure out how many more staff would we need to get to 10 out of 10.
Yeah, and I think my overall, just building off the comment before, is there's sort of the this moment in time, and is there opportunities for some immediate leverage relief while also going down this much bigger picture I think you want to bring to the
Mhm,
community, if I understand your focus, which is going to take a while.
mhm.
Yeah, for sure.
Yeah.
Um, I think I'm going to stop us there so that we end on time. Thank you so much for doing this. I think this is incredibly valuable for start, and we will be posting this video on our website, on our YouTube channel, and Jennifer will send an email out with the slides and maybe some additional information. But really appreciate everyone attending, and I think we now are on our early stages of really getting childcare like housing as a key sort of macro systemic issue that we can try to tackle. And maybe sometimes together, like URA is trying to do. So
Mhm,
thanks everyone, and thanks Jennifer for all the coordination and getting this going and
mhm.
helping me sort of co-facilitate. Take care, everyone.
Thank you.